welcome to this special show. Now that the lockdown has been extended, this means we are all going to be in our homes at least till the 3rd of May. Every time you go to buy eggs or even take your dog for a walk, please do remember to come back and wash your hands. We should not be careless and think, oh, we're just sitting home. We need to be even more precautious. Do remember to wear your mask and most importantly, social distancing. So in this episode, I'm going to tell you how we can protect ourselves and our loved ones. The importance of hand washing. Soap kills any bacteria and virus on our bodies. Soap molecules trap and destabilizes microorganisms. The virus will then detach from the skin and fall apart in soapy water. Tougher microbes will fall apart with vigorous scrubbing. Rinsing hands at the end washes dead bacteria and virus away. When we touch our eyes, nose or mouth with unwashed hands, potentially harmful microbes could be entering our system.
Wash your hands, let's go. Use enough soap, rub your hands properly.
20 सेकंड जरूर होगी। हाथ अच्छी तरह से साफ कीजिए।
And not only wash your palms, also wash the dorsum of your hand.
From any infection that is transmitted through person-to-person contact, hand washing with soap regularly is an effective way to help protect yourself and others from infection. COVID-19 is no different. In fact, hygiene and hand washing is extremely critical in this fight against coronavirus. This simple thing done consistently and properly can save lives. Washing one's hands is also one of the cheapest, easiest and most effective measures against the spread of the coronavirus.
Hand washing with soap is one of the most important health promotion and disease prevention activities, acts that we can engage in. And especially now, hand washing with soap is the first line of defense against coronavirus and COVID-19 disease. And here's why. Soap is actually a really powerful agent. It helps to inactivate the coronavirus. It's important for us to wash our hands thoroughly with soap. Before we prepare food, before we eat, before we feed our children, after we use the toilet, after we wash our children, dispose of children's diapers, when we cough, when we sneeze, when we blow our nose, when we're coming in from outside, when we may be coming in contact with objects and surfaces that may be contaminated, and when we may be in touch with people who are sick or unwell.
Hand washing is the first line of defense to protect ourselves from coronavirus. It's important that we wash our hands properly, and that too for at least 20 seconds. We need to make sure that we lather the back of our hands really well, in front, back, between the fingers, under our nails. We really need to scrub our hands properly, and then making sure that we wash off our hands well so that all the germs are off. So it's important, 20 seconds, don't forget that. In fact, there's a jingle also now. I mean, there are different things people are doing innovatively to actually wash their hands for 20 seconds. After your hands are washed, remember to clean dry them with a towel. In case you don't have a clean towel or a clean cloth, do remember to use a tissue or a napkin like I'm using. And also important to, again, dispose it off properly. Just for some reason, if you don't have clean water availability or you don't have soap, it's okay to sanitize your hands also well. It's equally effective, but the sanitizer must be at least having 60% of alcohol in it. Soap is more than a personal protectant. When used properly, it becomes part of a communal safety net. At the molecular level, soap works by breaking things apart. It is an effective way to destroy and dislodge many microbes, including the new coronavirus. How alcohol-based rub sanitizers work. Alcohol-based hand sanitizers can be as effective as soap if they are used properly, but they need to have at least 60% alcohol in them, as it's the alcohol that's the virus killer. Alcohol helps break up the germ membranes, but you need to make sure it gets into the direct contact with the bacteria or virus, hence using enough, and getting it all over the surfaces is important. In crucial times like this, where an acute shortage of essential commodities is seen, one can use either of them, soap and water or the sanitizer. Both are equally effective, but the technique must be correct. For many right now, the availability of hygiene products is a challenge. Hygiene hero Mr. Malika Arjuna Rao in Tade Paligudem distributed antiseptic liquid to all the police officers on duty in his area. It was his way of saying thank you to those working to keep others safe.
This time, government employees and police authorities, very hard work by coronavirus. My thought is the service motto to give Dettol liquids to all authorities of the police authorities.
Coronavirus spreads through tiny droplets when the infected person coughs and sneezes. Inhaling or touching surfaces that an infected person has been in contact with can lead to the spread of this infection. Disinfecting the right way is extremely critical, especially sanitizing the high-touch surfaces in our home.
Maintaining hygiene at home is concerned, it's important also to clean surfaces which can be touched frequently by people coming from outside, even the people who are cleaning the house and other individuals, and these include areas around the kitchen, your dining area, even in the drawing room. And I would suggest that these areas should also be cleaned using a disinfectant with a piece of cloth which you can then dispose of or keep outside so that it's not mixes with the other clothes. And also an important thing to remember is that if you disinfect this area with a piece of cloth, wash your hands after that, because the transmission will occur through your hands to your nose and mouth. And if your hands are clean, then no matter what you touch, you will not be able to transfer this infection from your hands to your face and mouth.
While cleaning is removing contaminants from a surface, disinfecting is about killing pathogens. High-touch surfaces are places which you touch the most, so it is important to clean and disinfect daily. Doorknobs, handles, table surfaces, hard dining chairs, kitchen and bathroom counters, faucets and faucet knobs, toilets, light switches, TV remote controls, electronic devices, toys, makeup. Initially, medical advisories suggested that only people with symptoms or those who were sick should wear masks to stem the spread of infection. But now the latest medical advice is that you should wear a mask while stepping out.
Post-lockdown India, you're going to be forced to step out of your homes with a mask. So buy a mask that's reusable, that has antiviral capabilities, and that you can desanitize or sterilize each day in a conventional oven, and that's the best way to beat coronavirus.
It's important to know how to use and dispose of the mask carefully. In fact, sometimes we try to touch the front or the back of the mask. We shouldn't do that. We should wear it very carefully with only the ear bands. These are some basic hygiene things that we should know about how to wear our mask. Coming up is a short break, and after the break we're going to show you that how corporates and celebrities are coming forward and help fighting COVID-19. Welcome back. While the coronavirus pandemic continues to create havoc across the world, everyone has come together to fight COVID-19. NGOs, brands, corporates, celebrities and the government, they are all trying to spread the message about social distancing, also reminding about hand washing.
Dettol is one of the big trusted brands that we have and is doing its best in trying to find the advent of coronavirus. So we're trying to do it through two ways. One is to increase the access of our products, right, to help and prevent the spread of coronavirus. We've also announced that we will give about 1 crore of soaps, right, so free. We will distribute it to the people who need the most through the right NGOs, right. So that is again to improve the access of the product. But at the same time, we also want to increase the habit of hand washing, okay? And it is not hand washing with Dettol. Do it with any soap, but do the habit of hand washing, and if it goes through a long way, it will help prevent the spread of coronavirus. Towards that, we have partnered with many popular faces, with the Indian Medical Association, etc., brought out a lot of communications that first tell the people about the need for washing hands, the need for washing hands with soap, okay, because it's an effective, easily available medium. Any soap is good, and also to do it with the right technique for the right duration. Amongst people who have access to both soap and water, only 10% people will wash their hands before preparing food. Only 20% people will wash their hands after coming into contact with sick people, right? So this is the basis of our of the habits that we have, and I think these are the ones, if we can make 5%, 10%, 15% difference in it, it will go a long way in preventing the spread of coronavirus, because that is how it spreads.
Celebrities have also come forward to help fight this battle. While many have donated, most have taken to social media asking fans to stay safe amid coronavirus.
The world is in a state of an emergency. This is a pandemic, we all know this, but every conversation ends with just the things that we've been reiterating again and again. So whether it's social distancing, whether it's staying at home, and the most important thing is wash your hands. If that's what the cure is, then that's what the cure is, and we have to follow that.
Message dena hai to one and all. 20 second tak karna Dettol.
Dettol launched a TikTok challenge aiming to get more people in India to wash their hands.
Hand washing is a very boring topic. It is not something that I'd like to hear it, or I wouldn't find it very enjoyable, somebody telling me how to wash hands and what seconds do you need to wash it. It's a boring topic, but it is a very important habit. To make the habit stick, we wanted to make the habit of hand washing cool, right? And TikTok is a fantastic platform that has reach not just in the metros, but in tier 2, tier 3 cities. It has a very, very wide reach, right? So we partnered with TikTok to make the habit of hand washing cool. So we created a jingle and a dance step, but that was focused completely on washing it with the right technique, front and back, up and down, with the nails, etc., and to do it for 20 seconds. It has been fantastic. We've gotten a lot of support where people, popular faces, Bollywood celebrities have come forward and wanted to be part of this campaign, have joined in and taken part in this Dettol hand wash challenge.
Salam hai salam, tere jazbe ko salam. Salam hai salam, tere jazbe ko salam. Kaam aisa kaam, tu kare ki tujhe salam.
Singer Mohit Chauhan has also composed and sung a new song, which is a tribute to Corona warriors fighting from the front line to save lives. From doctors, nurses, cops, vendors, sweepers, sanitation staff, supply chain employees, media and government employees.
Khud ki soche na tu ek baar, tu khada rahe ban ke jo dhaal. Us dhaal pe hai मान हमें, उस ढाल पे है मान हमें, तू है तो यकीन हम जी लेंगे. सलाम है सलाम, तेरी कुर्बानी को सलाम. सलाम है सलाम, तेरी हिम्मत को सलाम.
People who are working on the front line, everyone who's working outside while we all are safe in our homes, are the real heroes actually. They're not wearing capes, like they do in the movies. But if you look in life, they are the ones who are risking their lives. They're risking the lives of their families, of their loved ones, to keep us all safe and shielded from this deadly coronavirus.
It is India coming together, from everyday heroes to celebrities and corporates. How corporate India is helping. The Tata Group has pledged 1500 crore to the cause. Vedanta has contributed rupees 100 crore to the PM Cares Fund and sets up its own corpus of rupees 100 crore in the fight against coronavirus. Zomato's Feeding India initiative supports the families of daily wage workers through its own and public donations and have also set up a fund to cover up the lost earnings of its delivery partners and staff. Gautam Adani has announced Rs 100 crore contribution to various initiatives fighting COVID-19. Reliance Industries has contributed 5 crore to the Maharashtra CM Relief Fund and has opened India's first 100-bed hospital for coronavirus patients. The JSW Group has donated Rs 100 crore in the fight against coronavirus. Mahindra & Mahindra manufacturing units are making ventilators and its resorts are being used as temporary care facilities. ITC is setting up a contingency fund of Rs 150 crore for district-level rural healthcare for the poorest in society. Bajaj Group has pledged Rs 100 crore for upgradation of healthcare infrastructure, food, shelter and economic aid in rural areas. Diageo India has pledged to produce around 3 lakh litres of bulk hand sanitizer. And Hero Cycles has set up a Rs 100 crore contingency fund to tackle the virus.
We as corporates all have a sense of responsibility, and in India we have been nurtured like this. There are many instances when corporates all over the world step up support during crisis, be it natural calamities or other adversity. The pandemic, as we are all aware, is an unfamiliar territory and a completely new reality. We have a civic duty across industries to be together to contribute to combat the impact of COVID-19.
The government recently launched the Arogya Setu mobile app to help people identify the risk of contracting the novel coronavirus by using smartphones, Bluetooth and location services.
आरोग्य सेतु मोबाइल ऐप जरूर डाउनलोड करें.
Developed by the Ministry of Electronics and Information Technology, this app tracks users' movement and informs them if they may have come in contact with someone tested positive for the coronavirus. While the government is ramping up efforts to fight the crisis in whatever way possible, medical fraternities, celebrities and corporates, NGOs are leaving no stone unturned. But each one of us also has to be responsible, from wearing a mask to regular hand washing and most importantly, social distancing. India is enforcing perhaps the most extensive lockdown in the world, a social distancing effort aimed at containing the spread of coronavirus.
I do not have to be told to practice social distancing. I practice social distancing by choice because I care for myself and my family. I care for my fellow citizens. It is my civic responsibility. It is the call of humanity. It is because I want to break the chain of COVID-19 transmission. You may be young and restless, old and infirm, or just simply uncontrollable. If you find it difficult to practice social distancing, just think, this is the only way we can break the chain of transmission of COVID-19.
Mental health plays a very crucial role in fighting COVID-19. The pandemic has brought a lot of socio-economic uncertainties, which is leading to a lot of issues like addiction, depression, anxiety, and also suicide across the globe. The lockdown extension has made people live in fear of losing their businesses, jobs, earnings, savings, or even basic resources. The Inner Hour app is a self-help app for depression and anxiety, has also seen a 45% increase in the download of the application since COVID-19.
We've seen a big spike, almost 40-45% increase in the number of downloads just since COVID broke out. Even the therapy sessions, we've seen a 60-65% rise in the uptake over the last few weeks. And this is a trend that is true across cities in India. We're looking at data across about 60 cities in India. And we look at an increase in women users. There are cases that are being reported of all sorts of conditions. Anxiety, OCD, fear for your loved ones, health anxiety, healthcare workers feeling anxious about the risk of infection and bringing that infection back to other patients or to their family members. There are concerns around quarantine. We've seen a great increase in the number of domestic violence cases and verbal abuse cases, in divorce rates and in suicide attempts. There is a lot of concern among people who have pre-existing mental health conditions. We've seen an increase in relapse rates as well. There are existential worries that people have today, and there's a lack of motivation, as we all know.
Besides fighting the virus, right, which we are fighting collectively, what we're also fighting is uncertainty, right? There's so much ambiguity today around our health, our family's health, our finances, our jobs, the future, and that uncertainty itself can sometimes be the progenitor, the precursor for a lot of anxiety, right? So the first thing to do is to watch out when you're feeling a bit more restless, when you're finding it difficult to sleep, when your appetite is waning. So watch out for the signs. The second thing we are advising people is a few basic critical hygiene things. The first is plan your day. Set a routine, stick to it. Incorporate time for work, breaks, leisure and chores like you would do in your normal day. Second is talk to people, right? Talk to people who are in the house already, but also connect with others. And we recommend connecting to at least one person remotely every day. This is about physical distancing. It doesn't have to be about social distancing. In today's world, we have means to connect with others. The third is to be informed, but not over-informed.
For the coronavirus, there is no vaccine presently, so we must practice preventive measures such as hand washing, disinfecting ourselves, surfaces, our homes, practice social distancing and also wear masks. Also, we must remember not to just believe half-baked rumors on whatever comes on social media. We must understand that whatever information we are getting, it must be through a proper source and a good source so that we know what we are believing and trusting. Secondly, it's very, very important to take care of our mental as well as psychological health. Remember, together we can fight COVID-19, but it's important to protect ourselves and our loved ones.